And that time my blood pressure is already very high lah, almost 190. First of all, I noticed about this problem in 2015. I had a very bad headache, and I go to the clinic and check what is the reason. And that time my blood pressure is already very high lah, almost 190. So at that time I go to one of the specialists and check what is the reason. So I did my full body checkup, and we noticed that my kidney problem lah. Until last year, my previous doctor advised me to meet up with Dr. Rosna and get consultation for kidney transplant and also for dialysis, because my health situation that time is already serious. So he said this is time for you to decide for transplant and also for dialysis lah. So the symptoms that time is only my blood pressure.
We come check up here on July last year, 2021, and then we start the dialysis this year, 7 January, first dialysis, and then within 5 months we managed to do the transplant.
Okay, I can feel a lot of difference. First of all, in terms of my health especially, I feel much better. My blood pressure reduced. The normal pain like my leg swollen, leg cramp, everything is no more. I don't need to go for 3 days dialysis in a week, which actually got a lot of time for me at home. I can rest well. Very peaceful life at home.
The most important is she can eat everything now.
I can eat well, I can sleep well, I can rest.
I also can sleep well.
So actually, not only Dr. Rosna is involved for my treatment. So I got Dr. Rosna, Dr. Earl, Dr. Murali, and for my operation is Dr. Vijay, and my coordinator is Jenny. So all the doctors and also my coordinator is very helpful. They gave me appropriate advice whenever I required something, clarification or anything, and then they advised me. And actually they helped me a lot, not like a patient. They didn't treat us like a patient or like a donor or like a recipient, but they treat us more like their family member.
Actually, I feel very happy and I feel very rewarding that I managed to help this patient to go through this kidney transplant. Whenever we want to coordinate this transplant case, our mind is to want the case to be success. So sometimes we need to remind the patient and follow up many times with the patient, make sure the patient follow whatever we tell. And because all this is for their own good.
Generally, kidney transplant is considered the best treatment option for patients with end-stage kidney disease. Transplantation offer a better or a longer life to the patients compared to staying on dialysis. And kidney transplantation also offer better quality of life. When she came and see me, she was actually approaching to end-stage kidney failure. She started on dialysis and she didn't do very well on dialysis. She did not tolerate the dialysis procedure as she should. Now that she has received her transplant, she said that her health is so much better and she is so happy that she has more free time to enjoy things that she likes to do rather than spending those time on dialysis.